Hello nurses, welcome to another session of Nurse Talk. Today we are going to see the topic angina. Angina is a chest pain or discomfort that happens when your heart muscles does not get enough oxygen-rich blood. We have already discussed in detail about the coronary arteries. The coronary arteries supplies oxygenated blood to the cardiac muscles, and these cardiac muscles will help in the contraction and relaxation of the heart. Here we can see a normal coronary artery. See, this is a normal coronary artery, and this is a coronary artery with a blood clot or atherosclerosis. What is atherosclerosis? It is a collection of fat or cholesterol that will reduce the easiness of blood flow through the coronary arteries. So this is atherosclerosis in here, and otherwise there is a blood clot in here, which result in the reduction of blood flow and thereby the reduction in oxygen supply to the heart. So in case if the heart muscles are not getting enough oxygen or not enough oxygenated blood, the patient might have a angina. So now you know what is the cause of angina. Angina is caused by reduction of oxygen supply to the cardiac muscles. So totally we have three types of angina. First one is unstable angina. Second one is stable angina. Third one is variant or Prince-Metal angina. So we'll go in detail about every type of anginas. First one is stable angina. What is a stable angina? The stable angina is also known as exertion angina. As the name suggests, the exertion angina or stable angina is caused due to the patient's increased physical stress or exertion. That means if a patient is going through a strenuous activity or physical stress, or if the patient is going too much of physical activity, that can cause the stable angina for the patient. It's not just the physical activity, even if the patient has got an emotional stress. Even if the emotional stress of the patient can cause the stable angina for the patient. And then this stable angina is relieved by rust or nitroglycerin. Those who have worked in the hospitals or those who have got placements or postings in the hospital, you might have seen the GTN spray, which is used for patient who is having a chest pain. And this GTN spray is the nitroglycerin. Nitroglycerin. Remember, if a patient has got a stable angina, which is occurring due to the physical exertion or emotional stress, this heart or chest pain can be relieved by the rust or the nitroglycerin for the patient. And this is a predictable pattern. How is it predictable? So when a patient has got a stable angina, we already know that if the patient goes through emotional stress or strenuous activity, there is a chance or a risk for the patient to get the chest pain. That is how it is a predictable pattern. Now we move to the unstable angina. The unstable angina occurs in a patient who is at risk or even if the patient has a minimal activity. So the stable angina, when I said it is due to the increased physical or strenuous activity, unstable angina can occur for a patient even if the patient is on rest or even if the patient doing nothing or the patient is having a minimal activity, there will be a chance for the patient is getting chest pain, and that chest pain is called unstable angina. And unstable angina is also known as pre-infarction angina. Pre-infarction angina. I'll say the reason why it is called pre-infarction angina. But remember, unstable angina can occur for a patient even if the patient is on risk. And the next most important thing, this unstable angina is not relieved by rust or GTN or nitroglycerin. The rust or nitroglycerin spray is not going to help the patient because the unstable angina is not relieved by the rust or the GTN. And this is a medical emergency. It is the most serious type of chest pain is the unstable angina because this is a medical emergency. And why is it called pre-infarction angina? Unstable angina can be sometimes leading to myocardial infarction. Myocardial infarction, we all call myocardial infarction in another name, it is heart attack. So, most of the cases, the unstable angina is coming as a pre-infarction chest pain. That means the patient is on a risk of getting myocardial infarction. So that is why it is a medical emergency. And that is also the reason why this is called pre-infarction angina, because there is a risk of myocardial infarction for a patient who has an unstable angina. And remember, this angina is never going to be relieved by rust. rust or GTN is not going to help the patient who has an unstable angina. Now we move to the variant angina. It is the third type of angina, and the third type of angina, that is the variant angina, is also known as Prince-Metal's angina. See the Prince-Metal's name. One of the question paper have asked a question. What is the among the options given below? What is the symptom of the Prince-Metal angina? So when you see a question like that, you should remember that Prince-Metal angina is another name of variant angina, and this variant angina or Prince-Metal angina has one more name. It is nocturnal angina. Nocturnal angina. What is nocturnal means? Nocturnal means at night time. Night time. So the patient will often has the chest pain at night. That's why it is called nocturnal angina. And this is caused by the coronary artery spasm. And remember, this variant angina and Prince-Metal angina will be experienced by the patient even if the patient is on rest. Even if the patient is on rest, like unstable angina, the patient can experience the nocturnal or variant angina. And most important thing, this is relieved by GTN. It is relieved by GTN spray. So GTN spray will help the patient in case of variant angina and stable angina. Okay. So the most important things to remember in here is stable angina can occur for a patient who is going through a strenuous activity or exertion. That is, it is called exertion angina. It is also known as exertional angina. And this is relieved by rust or nitroglycerins. Relieved by rust or nitroglycerin. Unstable angina can occur for a patient even if the patient is on rest or with a minimal activity, and it is not relieved by rust or GTN. The rust or GTN is not going to help the patient who is having an unstable angina, and it is a medical emergency because the patient is at risk of myocardial infarction. The patient is at risk of myocardial infarction. That's why it is a medical emergency, and because the patient is at risk of myocardial infarction, this is also known as pre-infarction angina. Remember, the myocardial infarction is also known as heart attack. Okay, and then we studied about variant angina or Prince-Metal angina. This is often occurring for a patient at night time, and it is occurring at rest. Even if the patient is at rest, the patient can have a variant angina, and this is relieved by rust and GTN. The nitroglycerin and the rust will help the patient in variant angina and stable angina, but not in the case of unstable angina, and that's why unstable angina is a medical emergency. And then we are going to see the silent angina. It is not typical chest pain there. It's commonly seen in diabetics and elderly patients and detected on ECG or stress testing. So these are the three types. Mainly there are three types of anginas here, and the most important thing to remember is what type of angina. Stable and variant angina is relieved by rust and GTN, but unstable angina will not be relieved by the rust and GTN, and it can be causing a risk of myocardial infarction. So what is myocardial infarction? Myocardial infarction, also known as heart attack. So earlier we said the coronary artery supplies blood to the heart muscles. So if you haven't watched the class of anatomy of heart, which I was discussing about the coronary artery supplies, like oxygen and blood supply to the heart muscles, please go back and watch it. It will be helpful to all of you. So in case if there is a spasm or atherosclerosis or a blood clot which result in the lack of oxygen supply to the heart muscles, that results in the decreased oxygen supply to the heart muscles, the patient is at risk of having an angina. Okay, so imagine this condition, and in case this reduction of oxygen supply is going to be prolonged. Prolonged means for a long time the patient is not getting enough oxygen supply to the heart muscles, then the patient is going to end up with myocardial infarction or heart attack. Okay, myocardial infarction or heart attack occur when coronary arteries get blocked and a part of myocardial muscles die, because the myocardial muscles in here die due to the prolonged lack of oxygen supply to the muscle cells. And this is a irreversible damage that we are not going to reverse it. That means this distracted muscles because of the lack of oxygen. We cannot reverse that condition. That is a irreversible damage. It's occurring due to the prolonged hypoxia. That means reduced supply of oxygen to the heart muscles. And we all know we have when we say about the coronary arteries which supplies blood to the heart, we have two types of coronary artery. We have discussed it in detail in a previous session. So I'm just going to brief it now here. Coronary arteries, we have two types of coronary artery. First one is right coronary artery and left coronary artery. So the right coronary artery supplies to the right atrium, right ventricle and SA node, AV node of the heart. Left coronary artery has two branches again. Left anterior descending artery and left circumflex artery. Okay, left anterior descending artery and left circumflex artery. Remember, the most common site of obstruction in the blood vessels which result in the myocardial infarction occurs in the left anterior descending artery. So left anterior descending artery is a branch of left coronary artery, and this obstruction in the left anterior descending artery is the most common cause of myocardial infarction, and hence the left anterior descending artery is also known as widow's artery because the people, especially the men, die due to myocardial infarction, and this myocardial infarction is caused the most important location or the most common site of the atherosclerosis in the myocardial infarction is left anterior descending artery. Remember, left anterior descending artery is also known as widow's artery because that is the most common site of myocardial infarction. Okay. So when a patient has got a coronary artery here and an atherosclerosis in here, and there is an obstruction which result in the reduction of oxygenated blood supply to the heart muscles. Here is the heart muscles. And obviously, when the heart muscles are getting less level or reduced level of oxygen, they are going to have an ischemia or hypoxia. Hypoxia, that means reduction in the blood supply, oxygen and supply, and that will result in the angina. Because of the reduction in the oxygen supply to heart muscles, result in the angina. And if it is prolonged for a long time, if the patient is holding, most of the time this angina is unstable angina. The patient is going to have a prolonged unstable angina. The patient will result in myocardial infarction or heart attack, and this is a irreversible condition. So remember, if a patient has got an unstable angina, it is very, very important to consider it as a medical emergency and get proper treatment, because if the patient is going to have a prolonged unstable angina, the patient will result in heart attack or myocardial infarction. Another thing to remember in here, when I was talking about this stable, unstable and variant angina, I was saying that the rust and GTN spray will help the patients who is having angina. So what is a GTN or what is a nitroglycerin? Nitroglycerin is a vasodilator. Okay, what is vasodilator? Vaso means blood vessels. Dilator means it helps in the dilation of the obstructed blood vessels. That is a nitroglycerin. So when we administer a nitroglycerin for a patient, the patient's blood vessels are going to get dilated and helps in the enough blood flow through the coronary arteries or whatever arteries they are affected. So if we are administering, one of the most important nursing management for a patient who gets a nitroglycerin is, if you are administering a GTN spray or nitroglycerin for a patient, it's very important to assess the blood pressure of the patient, because there is a vasodilation happening here and there is a risk for the patient for hypotension. So it's very important to assess the blood pressure of the patient and check if the patient has got a hypotension immediately soon after administering the GTN spray for the patient. Okay, so remember the GTN spray is a vasodilator and it can cause hypotension for a patient. And when we were talking about the myocardial infarction, we already said myocardial infarction is most commonly seen in the left anterior descending artery. The occurrence is due to atherosclerosis. That means the lack of oxygen supply to the heart muscles for a prolonged period of time. Most common risk factor can be unstable angina, and this is an irreversible condition. So how are you going to diagnose or confirm the patient has got a myocardial infarction? Most important thing while confirmation of myocardial infarction is ECG. I have already done a video on electrocardiogram. In that video, I have discussed in detail about what will be the ECG for different cardiac disease condition. So now we are going to see ECG in myocardial infarction. So this is a normal ECG. PQRST. This is a normal ECG. In case of myocardial infarction, the patient is going to have either PQRST, ST segment depression. This ST segment depression is called STEMI. Sorry, NSTEMI. Non-ST segment elevation myocardial infarction. That's a type of myocardial infarction. Either the patient can have this or the patient can have PQRST. This is ST segment elevation. So this is ST segment elevation. STEMI is ST segment elevation myocardial infarction, and NSTEMI is non-ST segment elevation myocardial infarction. These two ECGs are seen in, this is a normal ECG, okay? These two ECGs are seen in myocardial infarction. So remember, when a patient has got a myocardial ischemia is occurring due to the lack of blood supply to the heart muscle. So in case a patient has a myocardial ischemia, the patient is going to have a ST segment depression, and this is a NSTEMI or non-ST segment elevated myocardial infarction. It's a type of myocardial infarction, and it is like there will be an ST segment depression will be here, and sometimes there will be T wave inversion also seen in this type of myocardial infarction or NSTEMI. Okay, and then now we went to the STEMI or ST segment elevation myocardial infarction. This is due to the plaque or total occlusion of the coronary artery, and there is be ST segment elevation in here. Okay, so these are the two types of myocardial infarction, NSTEMI and STEMI. STEMI means ST segment elevation in here. NSTEMI means non-ST segment elevation. ST segment elevation is not coming up here. These are the two types of myocardial infarction for a patient who has an MI. Okay, what is the management of MI? What is the management of myocardial infarction? Myocardial infarction can be managed by MONA. Management is MONA. What is MONA? M for morphine, O for oxygen, N for nitroglycerin, and A for aspirin. So remember, the management of myocardial infarction is MONA, morphine, oxygen, nitroglycerin, and aspirin. And along with that, we can also give anticoagulants and sedatives for the patient for management of pain. Okay, so remember, management of myocardial infarction is MONA, morphine, oxygen, GT, and nitroglycerin, and aspirin. Okay, so now we studied about angina. How is the angina coming? Like, what is the angina and myocardial infarction? Both of them are coronary artery diseases. And angina, there are mainly three types of angina. First one is stable angina. Then we studied unstable angina and variant angina. Stable angina occurs, it's also known as exertional angina, occur for the patient who is having a strenuous exercise or strenuous physical activity or emotional stress result in stable angina, and this is relieved by rest and nitroglycerin. Then we studied about unstable angina. Unstable angina is a type of angina occurring for a patient even if the patient is at rest. Okay, and that type of angina, the patient will not be relieved by rest and GTN. Rest and GTN is not helping in the patient for unstable angina, and it can also lead to myocardial infarction. The complication of unstable angina can lead to myocardial infarction or heart attack. Then we studied about variant angina. There is two other names for variant angina. One is Prince-Metal angina and nocturnal angina, because variant angina mostly seen in patient who is at night time or who is sleeping. So the nighttime angina, and this angina is also relieved by rest and GTN. Okay, and then we studied pre-infraction angina. That is, unstable angina is also known as pre-infraction angina, because the complication of unstable angina can be myocardial infarction, and this is not relieved by rest and the GTN spray, and this is a medical emergency. And then we studied about the nitroglycerin. Nitroglycerin. What is nitroglycerin? Nitroglycerin or GTN spray is a vasodilator. Very important to remember. It's a vasodilator that is going to dilate the blood vessels, so the patient will be at a risk of reduced BP or hypotension. So remember that it's a nursing management to assess the blood pressure of the patient who is administered with nitroglycerin or GTN spray. Then we studied about myocardial infarctions, also known as heart attack, that is occurring because of the prolonged lack of oxygen supply to the heart muscles. So we said the coronary arteries has two branches, two types of coronary artery, right and left coronary artery, and the most common site of myocardial infarction is a left anterior descending artery. Left anterior descending artery is the most common artery for myocardial infarction. It is also known as widow's artery, and when there is a prolonged lack of oxygen supply to the heart muscles, the heart muscles are going to have an ischemia or hypoxia. Hypoxia will result in the irreversible damage on the heart muscles, and that cause MI. Okay, so the prolonged reduction in oxygen supply can be because of the unstable angina. So that is why unstable angina is a medical emergency, that once a patient has an unstable angina, it's very important to give or provide with a proper medical care as quick as possible to reduce the chances of myocardial infarction. Then we studied about the ECG in myocardial infarction. We said we have STEMI and NSTEMI. STEMI is the ST segment elevated myocardial infarction. And when we drew the image PQRST, ST segment elevated myocardial infarction, and in this this is a type of myocardial infarction. It's a type of myocardial infarction. Then we studied about the NSTEMI. NSTEMI means non-ST segment elevated myocardial infarction. That means there will be RST, depression of the ST segment, and this is also being seen in myocardial ischemia. Okay, these are the two types of myocardial infarction. So in case if in the question paper it comes up like an image of ST segment depression, there is an image of ST segment depression in your question paper, remember it is either myocardial ischemia or myocardial infarction. Only one option will be there, either ischemia or infarction. That is the right answer, because there is a ST segment depression. In case of an ST segment elevation, this is STEMI, ST segment elevated myocardial infarction. ST segment elevation. And then we studied about the management of myocardial infarction. Remember MONA. Management of myocardial infarction, remember MONA. MONA is morphine. MONA is for morphine, oxygen, GTN, and morphine, oxygen, nitroglycerin, and aspirin. So remember MONA for myocardial infarctions management. MONA for myocardial infarction management, morphine, oxygen, nitroglycerin, and aspirin. These are the medications immediately given to the patients in case if the patient is suspected for a myocardial infarction. Thank you very much for watching this video. I hope you all understood what I am trying to explain in here, and types of anginas, and what are the questions that can be asked from this topic. Okay, just in case if you have got any questions to ask me, you can pop it in the comments, or in case if you have if you want me to explain any particular topic for your nursing exams or university exams, please pop it in the comments and I will get back to you. Thank you very much for watching again. Bye bye.